Bipolar disorder is a mental health condition that affects millions of people around the world, yet it remains widely misunderstood. At its core, bipolar disorder is characterized by dramatic shifts in mood, energy, and activity levels that can make daily life challenging. These shifts go far beyond the ordinary ups and downs that everyone experiences. For people living with bipolar disorder, these changes can be intense, unpredictable, and deeply disruptive. Imagine waking up one day feeling on top of the world, full of energy, ideas, and confidence. You might talk faster than usual, feel like you don't need much sleep, and believe you can accomplish anything you set your mind to. This is known as a manic episode, one of the hallmarks of bipolar disorder. During mania, a person may feel euphoric, unusually optimistic, or excessively irritable. Their thoughts may race, and they might take risks they wouldn't normally consider, such as spending large amounts of money, making impulsive decisions, or engaging in reckless behavior. However, the high of mania is often followed by a crash, a period of deep depression. During a depressive episode, the same person might feel hopeless, exhausted, and unable to find joy in activities they once loved. Simple tasks like getting out of bed, eating, or talking to friends can feel overwhelming. They may struggle with feelings of worthlessness, guilt, or even thoughts of self-harm. Bipolar disorder isn't just about having mood swings. The changes in mood are much more severe and last longer than typical emotional reactions. These episodes can last for days, weeks, or even months, and they can have a profound impact on work, relationships, and overall quality of life. There are several types of bipolar disorder, each with its own pattern of mood changes. The most well-known is bipolar I disorder. This type is defined by the presence of at least one manic episode, which may be preceded or followed by depressive episodes. Manic episodes in bipolar I are often so severe that they require hospitalization to prevent harm to oneself or others. Bipolar II disorder is a closely related condition, but instead of full-blown mania, individuals experience hypomania, a less intense form of mania. Hypomanic episodes can still involve increased energy and activity, but they are not as extreme or dangerous as the manic episodes seen in bipolar I. However, bipolar II is often marked by longer and more frequent periods of depression, which can be just as debilitating. There is also a form called cyclothymic disorder, or cyclothymia. People with cyclothymia experience chronic fluctuating moods that are less severe than those in bipolar I or II. They have periods of hypomanic and depressive symptoms that last for at least 2 years, but the symptoms don't meet the full criteria for mania or major depression. What causes bipolar disorder? The answer is complex, and researchers are still unraveling the mysteries of the brain. Genetics play a significant role. If you have a close relative with bipolar disorder, your risk is higher. However, it's not just about genes. Environmental factors, such as trauma, high stress, or major life changes, can also trigger the onset of symptoms in people who are genetically vulnerable. At the biological level, bipolar disorder is associated with imbalances in neurotransmitters, the chemicals that help brain cells communicate. These imbalances can disrupt the brain's ability to regulate mood, leading to the extreme highs and lows of the disorder. Diagnosing bipolar disorder can be challenging. The symptoms often overlap with other mental health conditions, such as depression, anxiety, or even attention deficit hyperactivity disorder, ADHD. Many people with bipolar disorder are first diagnosed with depression because depressive episodes are more common and typically the first to appear. Recognizing the patterns of mania or hypomania is key to an accurate diagnosis. Treatment for bipolar disorder is highly individualized, but it usually involves a combination of medication and therapy. Mood stabilizers, such as lithium, are often prescribed to help control the swings between mania and depression. Other medications, like antipsychotics or antidepressants, may also be used depending on the person's symptoms. Psychotherapy, or talk therapy, is another important part of treatment. Cognitive behavioral therapy can help individuals recognize early warning signs of mood episodes, develop coping strategies, and manage stress. Education about the disorder is crucial, not just for the person affected, but also for their family and friends. Living with bipolar disorder can be challenging, but with the right support and treatment, many people are able to lead fulfilling and productive lives. It's important to remember that bipolar disorder is a medical condition, not a personal failing or a character flaw. Reducing the stigma around mental illness helps create a more compassionate and supportive environment for those who are struggling. If you or someone you know is experiencing symptoms of bipolar disorder, reaching out for help is the first step. Early intervention can make a significant difference in managing the condition and improving quality of life. Mental health professionals can provide a proper diagnosis, develop a treatment plan, and offer ongoing support. Bipolar disorder is a complex and often misunderstood condition, but understanding its symptoms, causes, and treatments can help break down barriers and encourage empathy. By learning more about mental health, we can all contribute to a world where everyone has the opportunity to thrive, no matter what challenges they face.